A woman comes to the dentist with a slight swelling in her jaw. Nothing dramatic, no severe pain, just something feels off. The dentist orders an x-ray, and then he freezes. Almost the entire right side of her jaw is missing. Not cracked, not fractured, gone. A massive hollow space fills the bone, about the size of an orange. The remaining bone is so thin it looks translucent on the scan, like an eggshell. One wrong bite, one hard piece of food, and her jaw could have snapped from the inside, like a dry branch. When I first read about this case, I honestly didn't believe the measurements. I've seen cysts in my own practice, 1 centimeter, maybe 2, but this was something else. Her name was Maria, 36 years old. 2 kids, a completely ordinary life. About a year earlier, she noticed a small swelling on her cheek. No pain, no redness. She ignored it. Then something stranger started happening. Her teeth felt like they were moving, shifting slightly inside her jaw. Here's the terrifying thing about radicular cysts. They grow silently. No symptoms, no warning signs. They usually start from a dead tooth, often after incomplete root canal treatment or untreated decay. A tiny fluid-filled sac forms at the root, millimeter by millimeter, year by year. It slowly dissolves the bone from the inside. In Maria's case, the cyst had been growing for 5 years. It started from a single premolar, a tooth treated back in college. The root canal was never fully sealed. The infection stayed. By the time she finally saw a doctor, the cyst measured 7.5 centimeters in diameter. That's a large orange. It occupied almost the entire right side of her jaw, pushed the teeth out of position, dissolved the bone until only a thin shell remained. The CT scan was even worse. The lower border of the jaw, the strongest part, the one designed to withstand massive chewing forces, was only 2 millimeters thick, less than a credit card. The doctor told her bluntly, if you bite down on something hard, a nut, a candy, your jaw will fracture right through the middle of your face. A pathological fracture. She went pale. She thought about how many times she had eaten, laughed, yawned, completely unaware that her jaw was one bite away from breaking. Giant cysts like this are rare. Only 7 to 8% of radicular cysts grow larger than 5 centimeters. Most are discovered early, by accident, during routine x-rays. But Maria hadn't been to a dentist in years. Treatment was complex. First, decompression. A small opening was made in the gum. A drainage tube was inserted to slowly release the cyst's fluid. For 3 months, she lived with that tube. Weekly checkups. Slowly, the pressure decreased. The bone began regenerating at the edges. Then, surgery. Complete removal of the cyst, extraction of the dead tooth, meticulous curettage to remove every trace of the cyst lining, and reconstruction. Bone grafts, a titanium mesh. The surgeons rebuilt the jaw from the inside, shaping it like sculptors. Without this, the bone would remain weak, deformed, at constant risk of fracture. 1 year later, Maria returned for follow-up. The x-ray showed near complete bone regeneration. Her jaw was strong again. She could chew, laugh, live without fear. But here's what I can't stop thinking about. 1 dead tooth, 1 poorly treated root canal, and 5 years later, a massive cavity capable of snapping a jaw from the inside. She walked around for years with a ticking bomb in her face. So, ask yourself this. How often do we ignore small problems, postpone doctor's visits, tell ourselves it'll pass, while somewhere inside, something is already growing?